This video will go through heel pain when running, some of the causes, suggestion of something to try, and at the end I'll give details of where to go to help you increase your leg flexibility, and if you are still confused, where to go from there. I know that if you're a runner, you just want to keep on running. Despite any pain, you're probably still going to carry on running if you've got pain. But really, that's what I'm here to help with, is take you through some of that uncertainty and give you the next steps through to help you recover. My name's Claire, I'm a physiotherapist from PhysioFit Health. I'm here to help you move really without pain or issue. And to get more of our expertise, then subscribe to our YouTube channel. Before I go on to the causes of heel pain, it's really important for me to say that pain is actually fairly complex. Generally, there's a number of different things that will add to your pain and your symptoms, not just the one thing. So it's important just to try and unpick what's going on with the pain. You can have causes of pain, and stress and anxiety can add to the pain, lack of sleep. Normally people think about the mechanics, the muscles, the joints, but there's actually a whole range of other things in play. So this video is just general advice only. It's not designed for specific healthcare advice. Book yourself an appointment if you need to get a little bit more specific advice. So there's a number of different causes for heel pain, and when you're talking about the heel, it's really then important just to kind of figure out, where are you meaning? Are you meaning at the back of the heel, or are you meaning underneath? So just kind of into the base of that foot as you're kind of putting that foot down. So it's really just kind of identifying exactly where. Sometimes pain can be just a little bit further up, so not quite at the back of the heel, but just a tiny bit further up. So yeah, just kind of identifying really where you're talking about, where you're meaning with this heel pain. Pain at the back of the heel, that's where your Achilles comes into things. Could be an irritation of the tendon, which is just a little bit above the back of the heel. Or you could get an irritation directly at the back of the heel. So that could be tendon irritation. You can get heel spurs, which are generally underneath the heel, so that's a little bit of extra kind of bony growth. Plantar fasciitis, those suffering from that will get pain at the base underneath the heel that can potentially spread a little bit further into the bottom of the foot. The pain can be caused by overworking muscles, a little bit of a muscle imbalance. So potentially the ankle joint is a little bit stiff, causing these muscles around the heel and the foot just to be working a bit too hard, and that can cause irritation. And then, of course, you've got your referred pain. The back can refer all the way down the leg and actually into the heel and the foot. So, yeah, all these things you kind of need to figure out and rule out if it's one thing or the other. Question I'd get you to ask is really what you've been doing with your running. Have you been not really doing very much and then all of a sudden gone to running multiple times a week? Or have you changed up your running a little bit and started doing a little bit more of the intervals? So maybe you're just doing kind of the hill sprints or the interval style running, where you've just got a little bit more kind of explosive power. That sudden change in routine can actually irritate the tendons around that heel and might be a cause of some of that pain. So if you haven't given yourself enough time really to adjust to the type of routine, exercise routine that you are trying to do, it is worthwhile just kind of easing off a little bit just to let things settle down. But movement can generally, be a good thing, and you can actually use it to help. If the tendon's irritated, which can happen if you go from the all or nothing routine, from doing nothing to doing loads, the tendon can be irritated, and you can use an exercise just to get a little bit more blood flow to the area. So watch this clip just to get an idea of what to try. Okay, so you've got your heel pain at the back here. I'd suggest getting a chair so you can hold onto the chair, and you're going to raise yourself up onto your tiptoes. Now, if the left side is the side that's causing you the problems, you are going to take that right foot away. which is where your chair comes into things. And then very, very slowly, so counting to 5 to 10 seconds, you're slowly going to lower your heel all the way back down again. So I'll go through that one again. So you raise yourself up onto your tiptoes, take that right foot away, and then very slowly you're going to lower your left heel down. Now this one is trying to get the blood flow to the tendon, like we're saying. So the slower you can lower that heel down, the more blood flow that's going to be coming in and around the back of the heel. If you've tried a few things already, some exercises and that static exercise that we've just gone through, and you're finding it doesn't really help that much, it might mean that you just need to figure out what else is causing the issues, and that's where the online physio consultation can help with, and we can go through your own individual circumstances and help you figure out where you need to go and what you need to try. If you're interested in improving or maintaining your leg flexibility, keeping the range of movement, in my opinion, is a massive win for just reducing the risk of any aches and pains. Then we've got an 8-week deep squat challenge for you to try. The details are in the description below. In that challenge, you'll get a weekly email with exercise suggestions, and you're just going to focus on the different joints and area of the leg. And so you'll slowly build up this lovely routine that you can work towards and know some great exercises that will help give you that leg flexibility, which then has that knock-on consequence for your running. It can help just make the running a little bit more fluid, and like I say, just kind of reduces that risk of aches and pains. So details in the description below. To summarise what we're saying in this video, there are of course many causes of heel pain when you are running. It might just be that you haven't given the body enough time to adjust to what you're asking it to do. And you can use that exercise that we went through just to get a little bit more blood flow to the area. It can act as a painkiller and can help you start to reduce those symptoms. If you catch these aches and pains early enough, it can be fairly straightforward to settle it all down. However, if you leave it for a long time, then it can just be that little bit harder. It might just take that little bit longer. So just worth bearing in mind. If you're still confused or you would like just a little bit more individual advice, then book yourself an online appointment with us and we'll go through all of what you have been doing, all of the symptoms, look at the range of movement that you've got, go through a few tests, and we'll help you figure out really what your next steps need to be and give you an idea of the exercises and plan for you just to help you improve. See you soon.